So good morning. So I'm gonna perform an area clearance device. So first is before going inside the patient's room, I always have to check the patient's chart, obtain any important information. So once going inside, we introduce ourselves. We also have to check the patient's ID band for confirmatory purposes, and then we can proceed in explaining this, such as telling them good morning. So my name is Anthony. So this one is an area clearance device. The purpose of this is it would help you clear up your airways, remove any secretions, prevent also your lungs from being collapsed. So this one, especially you just came from a nebulization treatment, this would really benefit you. So first is we reassess the patient, obtain vital signs. Once you're done, reposition the patient in a upright position. Let their elbows rest on the table like this, and then let the patient hold it by holding it like a microphone using both hands, or at least or even a one hand, not just letting them avoid them from blocking the flutter valve. So when instructing this, we use most of the time with a mouthpiece. So by using a mouthpiece, allow the patient to take a tight seal with the tongue underneath, not blocking the mouthpiece. And then we should also have another option in place with the mask, just in case if the patient could not tolerate the mouthpiece. So by doing it, let the patient take a slow deep inspiration. So by taking a slow deep inspiration, and then after that, allow them to take a strong exhalation, not in a forceful manner. So at least we are able to reach the goal of 3 to 4 seconds. And then after that, remove it and then let the patient cough. So initially, we always make sure we start it in about 3 to 5 times every hour, not more than that, to prevent any complications. If the patient is experiencing any lightheadedness or dizziness, please terminate immediately the therapy. And then another thing to note is when doing this, we start it initially in the lowest setting, so we can also twist it or dial it if we want to exceed more. But initially we start in the lowest setting. And then once everything is done, we always have to take note of its color, consistency, and amount if the patient expectorates with its sputum, and then make sure we have a basin where they would expectorate, or even a specimen cup, just in case if the physician would like to obtain any specimen. So another thing to note with this one is educate the patient by not soaking this in water, because it will affect a valve. And then when instructing it also, let the patient know that they will sense any fluttering inside or any resistance or obstruction. So all they have to do is continue blowing out. And then with the fluttering, that would help them cough even more. And then once you already let the patient expectorate, make sure we also have to tell them that the mouthpiece should be clean and air dried with sterile water. And then even though they already have a nebulization treatment, let the patient know they can also use this every hour, so that they can ensure that their cough reflex is strong. So they can store this one in a plastic container with its name on it. They can hang or just put it on the side. And then also another thing is, once everything is done, make sure we reassess the patient, obtain vital signs. And then another thing is, we always have to observe the patient if they are doing well. And then once you're done inside, make sure we wash our hands, remove PPE if we wear them, and then chart everything outside, what we observe to the patient, and then educate and communicate by the way with the nurse staff.